Hello, I'm Kristin O'Donnell, and I'm a trauma center, trauma sensitive yoga facilitator. Trauma center, trauma sensitive yoga is an evidence based practice that includes invitational language and choices so that the participant can find their own power and agency within their body. A practice called interoception is also used in this type of yoga. And interoception is the ability to notice sensations in your body when you move a certain way. So if I were to move my arm to the side, I might notice some sensation in my shoulder. I might notice some sensation in my arm. And that is interoception, the ability to notice how we are feeling in our bodies when we move a certain way. Trauma-centered, trauma-sensitive yoga was created with a group of people with PTSD who were not responding to clinical therapy. And it was added to their therapy in order to see if yoga helped bring a change about for them. Through this study, they found out that yoga did help immensely. And trauma-centered, trauma-sensitive yoga has been used with people with complex trauma, PTSD, anxiety, high stress levels, and can be used by anyone who is looking for a slower paced, intuitive, and connective practice to bring themselves back into their bodies. I'll be showing you a short segment of what a trauma-centered, trauma-sensitive yoga class might entail to give you an idea of what this type of yoga might look like. Please know that this yoga is presented in a way that the teacher is the facilitator, guiding you through the shapes, but as the participant, you can choose whether or not to follow along. All the movements are brought about in an invitational way, allowing you to make the choice whether or not to move in that way for yourself. There are also choices brought about in every shape that we walk through, and you can make the choice whether or not to move in that way as well. With this practice, you are able to move in any way that you would like in your body, and that can be something completely different than what the facilitator is doing. So if you'd like to join me for a short trauma-centered, trauma-sensitive yoga practice, you might like to start in a seated shape. So maybe finding whatever seated shape you might like, and knowing that this is your practice and you can choose to move through it in any way that you might like. If you'd like, maybe starting to move your head from side to side. Another choice might be to move your head up towards the ceiling and down towards the ground. One choice might be to move your head from side to side, left to right. Another choice might be to move your head up towards the ceiling and down towards the ground. If you'd like, a third choice might be to add some head circles in your movement. So you might choose to move your head from side to side in a half head circle, or you might choose to move your head all the way around in a full head circle. Finding whatever movements you might like for yourself, and maybe experimenting with any or all of these choices, possibly moving your head from side to side, possibly moving your head up and down, or maybe moving your head in half or full circles. Whenever you're ready, maybe slowly starting to bring your head back to center. And if you'd like, maybe choosing to move your upper body from side to side. Another choice might be to move your upper body forward and back. And a third choice, if you'd like, might be to move your upper body in circles. Finding any movement or stillness that you might like to bring into this shape, possibly moving your body from side to side, maybe moving your body forward and back, or a third choice, maybe moving your body in circles. And if you'd like, possibly experimenting with any or all of these choices. And whenever you're ready, maybe starting to bring your upper body back to center. If you'd like, maybe bringing one hand to your side, to the floor, maybe bringing your other hand up overhead for a gentle side stretch. If you'd like, you might choose to pause in this shape, or if you'd like to add movement, you might choose to move from side to side, maybe bringing the opposite hand to the floor and the other hand up overhead, possibly pausing on one side of the shape for as long as you might like. And if you'd like to add movement, maybe moving back and forth from one side of the shape to the other. In your own time, coming back to center whenever you're ready. And possibly moving to bring your hands and knees to your mat. So maybe finding your way to your mat with your hands and knees on the mat. And one choice might be to lift your head to look in front of you. Maybe there's a little curve in your lower back. Head and chest look up. This might be one choice. Another choice might be to lower your head down and curve your lower back up towards the ceiling. This might be another choice. And a third choice might be to connect these two shapes together. So maybe moving with your head and chest looking in front of you with that curve in your lower back. And then in your own time, maybe lowering your head down and curving your lower back up towards the ceiling. So possibly moving from one shape to the other, if you would like to, or you might choose to pause in one shape for a few moments before moving to the other shape. And you can choose, maybe there's just one shape that you want to stay with. Feel free to do that as well. So you can choose with experimenting with one shape or both, with adding movement or stillness. Finding whatever you might like with these two shapes. Whether you move from one to the other, or maybe you find stillness in one or the other. And whenever you're ready in your own time, maybe slowly starting to bring yourself back to center, back to a neutral shape with your hands and knees on the floor. Another choice might be maybe to extend one leg out behind you. You might choose to pause in this shape. You might choose to lift your leg up a little bit, maybe keeping it hip height. And if you'd like to add movement, maybe you start to bend and straighten your leg a few times. So there's a few choices with this shape, maybe extending your toes behind you and pressing them into the ground. Maybe lifting your leg up and pausing. Or another choice is to add movement, maybe bending and straightening your leg a few times. experimenting with any or all of these choices, and in your own time, maybe bringing your leg back to the mat. If you'd like, maybe moving to the other side, you might choose to extend your other leg behind you, maybe pausing while pressing your toes into the mat. If you'd like, you might choose to raise your leg, maybe hip height, possibly staying there. Or if you'd like to add movement, maybe choosing to bend and straighten your leg a few times. Moving from one choice to the other, maybe staying with one choice for a little bit if you'd like. You might press one foot behind you, maybe pausing in that shape, maybe lifting your leg up and pausing there, or maybe choosing to bend and straighten your leg a few times. Whenever you're ready, maybe bringing both feet back to the floor, and in your own time, maybe starting to find your way back to a seated shape. So this is a short guide to what a trauma center, trauma sensitive yoga class might look like. So you can get a feel for the language of the facilitator, you can get a feel for some of the shapes and choices that you might be offered. In these classes, when they're in person, the facilitator stays on their mat. They do not move about the room. And there is no touching of any students. As I mentioned, the facilitator stays on the mat and they do the shapes with you, so you have a guide as you're moving from one shape to the other. If you'd like to learn more about trauma center, trauma sensitive yoga, feel free to reach out to me at connect@groundworkwellness.com. Or if you'd like, you can find a 20-minute video of a trauma center, trauma sensitive yoga class on the same channel. Thank you so much, and I hope you have a wonderful day.